little problem. We got this beautiful leg that's ready to fit and deliver for this next week, but no shoes. Why are we buying a patient shoes? Well, for this patient, she had a wound on one side, so she actually threw out all of her shoes. And so that's actually common with our patients. After an amputation, they just throw out all their shoes, or they at least throw out the side that was amputated on. The other issue is if they don't have shoes that fit appropriately. Main things to keep in mind, especially for diabetic patients when you're looking at shoes, is heel counter of the shoe. You don't want it to be too stiff, but you don't want it to be too mushy or too soft either. When you're flexing the shoe, you want the shoe to flex at the widest part, because that's where your foot is going to flex. When you're trying on the shoes, don't tighten it down too tight. Prosthetic humor. Make sure you have at least a thumb width from the end of the foot to the shoe. This is one of the most common problems that we see, people wearing their shoes too tight. That can cause bunions and all sorts of other skin breakdown, especially for your diabetic patients with neuropathy. Check over the metatarsal heads, that's the widest part of the foot, to make sure there's enough space. Not just a wider shoe, but a deeper toe box shoe as well. That will just give more room for the foot. Check over the dorsum of the foot to make sure there's a little bit of give that material. So often patients wear their shoes too tight, and for diabetic patients with neuropathy, that is going to cause problems. All about trying to prevent amputations. Thank you for joining us for shoe shopping. Be sure to stay tuned so you see her delivery, and we're going to get the rest of the shopping done. Mwah.